Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Mastering Weight Management, Boosting Metabolism and Lasting Results, presented by Dr. Jean Huang. Dr. Huang's philosophy of care revolves around providing a whole-person approach. She believes the endocrine system reflects the imbalances occurring in our lives, whether from family, friends, work, school, or other factors. Dr. Huang's approach is to develop an integrative plan with her patients, creating a collaborative, attainable, and effective care plan together. And now, please welcome Dr. Huang.
Hi everyone. So today I'm going to present a very popular topic, obesity or weight. It's a modern disease, so let's go ahead. Traditionally in the medical world, we have the definition that's been focusing on measuring body mass index to define obesity. So what is body mass index, which is weight divided by height square? But are we really measuring the true obesity? As you can see in this graph, two men here have the same weight, but they have different body fat and muscle proportion. And I would not define them as obesity for both of them. So now as the science is advancing, we find that the best individual assessment is actually through waist circumference. It provides additional information regarding adipose, which is fat tissue function or dysfunction, or the other way is to measure percentage of body fat. So obesity, as the Obesity Medicine Association defines, it is a chronic, progressive, relapsing, and treatable multifactorial neurobehavior disease, wherein an increase in body fat promotes adipose tissue, which is fat tissue, dysfunction, and abnormal fat mass physical forces, resulting in adverse metabolic, biomechanical, and psychosocial health consequences. Yeah, it's a mouthful, but I want to highlight here, it is chronic and progressive. So a lot of patients come to me and want to talk about weight management, but because it is a chronic progressive disease, there is no one shot or a straightforward, fast solution. It is relapsing as well. So if you have done it before, it could come back and treatable. So there is hope, meaning a lot of weight management frustration, it is still treatable. So I want to give everyone hope. Weight management is possible, but it is multifactorial. So I won't be able to give you a straightforward answer, such as, oh, do this, or there's a perfect recipe, a perfect exercise regimen to do. It's multifactorial. And neural behavior. So there are a lot of factors that we have to take into account when we are assessing your obesity and also treatment for your obesity. And when obesity advances, it becomes metabolic syndrome. And here are the criteria for metabolic syndrome. As one can see, besides the waist circumference, there are also lipid panel abnormalities such as serum triglycerides over or equal to 150 milligram/deciliter, or drug treatment for elevated triglycerides, serum high density lipoprotein cholesterol less than 40 in men or in 50 in women, or drug treatment for low HDL cholesterol. Blood pressure here is also included, larger or equal 130 over 85 Hg, or drug treatment for elevated blood pressure, and lastly, fasting plasma glucose over or equal 100 milligram/deciliter, or drug treatment for elevated blood glucose. So we can see here as obesity increases, there are a lot of changes or abnormality that you will see in lipid panel, blood pressure, and also your glucose metabolism. And in JAMA journal here that we could see metabolic syndrome is more predictive of cardiovascular heart disease than age, BMI, systolic high blood pressure, and smoking. Other obesity-related disease also include polycystic ovarian syndrome, gallbladder disease, non-alcoholic fatty liver disease, sleep apnea, depression, and cancer. So where do we start? Meal plan or workout plan? I'm sorry. So there is really no one plan fit all. And where do we start is really to find a medical professional and take a thorough weight history to kind of understand what has your weight become. Like what we say, it's a chronic progressive. So there are going to be points of your life that you are seeing your weight has been progressively changing. Review lifestyle activities and other factors that may contribute to weight changes. And lastly, formulate a sustainable plan. So I'm going to give you more tips to talk about the obesity management. So today, as a short presentation, we're not going to go in the depth in terms of the assessment, but there are some tips to look at. So in terms of our dietary or nutrition intake, factors that are associated with fat accumulation includes rate of eating. So what the celebrity is doing in terms of the frequency of their chewing, they're chewing more than 100 times, it does activate histamine neurons to suppress our physiological food intake or suppress our appetite. Time of eating. So breakfast, it is truly the most important meal of our day, and that will prevent or may prevent weight gain, since it's multifactorial, not one factor, may prevent weight gain by changes of circadian control of hunger and appetite. Lastly, type of intake. So we really want to avoid sweetened beverage and high glycemic index foods. Other non-traditional factors that people don't think about is reduced sleep time. So when you're limiting a single night to 4 hours of sleep, decreases peripheral insulin sensitivity by 20 to 25%. And that would really influence how your glucose is metabolized in your body and also promote fat accumulation. Thyroid is another very important hormone that controls our metabolism, and its duration is blunted when you have less sleep. Shift of circadian rhythm may be disturbing resting metabolic rate in healthy individual. Poor sleep quality also links with increased hunger or uncontrolled emotional eating. Smoking cessation. So smoking, it's a complicated behavior issues. A lot of times people use smoking to help with stress management, or it's a habit, or sometimes it link with eating, snacking as well. So when you're quitting smoking, there is an association with weight gain, given nicotine has thermogenic and appetite suppressant effects. Resting metabolic rate decreases after smoking cessation as well. However, in women, nicotine has anti-estrogenic effect that favors fat distribution, which means higher risk of abdominal visceral fat deposition or abdominal obesity. Emotional stress. So this, people don't really think about it, but emotional and stress eating go hand in hand. Stress system and cortisol release through hypothalamic pituitary adrenal axis can be a cause of obesity as well. Depression actually stimulates the hypothalamic appetite centers to increase food intake and parasympathetic input into upper gut that enhances fat storage. Physical activities. So, a lot of times we will hear the doctor say, please, increase your exercise, or please go exercise. And there is a reason for it. It not only just rigorous exercise, but some physical activities, even walking. And that could attenuate genetic predisposition to obesity. Most of the base metabolic rate, about 80%, are directly proportional to the amount of lean tissue mass, meaning the muscle mass. during exercise, muscle can account for 80 to 90% of energy expenditure, especially during high intensity exercise. So a lot of things I tell my patients is that we don't have to set really big goal. We just have to do small goals and make small changes each day. So for example, have long working hours, desk job, it's really hard to squeeze in gym time. Perhaps some of the tips is that, take more breaks from the computer, do a 5 or 10 minutes water break, or take stairs, to your office, or park a little bit further at the parking lot. So that all counts as physical activities or increase in your activities. So as we were mentioning here, that sitting or physical inactivity, excessive sitting is associated with obesity and diabetes independent of physical activity. Encourage a patient to take a break. So as we were mentioning, every 30 to 60 minutes to stand up, walk from their sitting jobs. Epidemiologically, the relationship of physical inactivity to weight gain appears to be more consistent than the relationship of excessive energy intake to weight gain. Wow. So yes, please stand up and take some activity and move. So as I mentioned, this is a very short presentation and there are a lot to cover, but I do want to encourage everyone that there is hope, it is treatable, and that we need to formulate a sustainable plan so we can keep moving forward, making small goals, and make changes.
Thank you, Dr. Huang. We do have a couple of questions here. The first question is, something we'd like you to comment on. So many people look to social media for weight loss solutions. What should we be aware of when reading these posts?
So I think that a lot of times people go onto social media to look for meal plans or even medication. For sure, medications, I will definitely warn everyone with a grain of salt, given the popularity of the GLP-1, the injection, or Ozempic, Mounjaro, Wegovy, Zepbound. There is a really national shortage. So there are a lot of social posts about, compound medications or other miracle medications. And as we mentioned in the presentation, that obesity is a chronic, progressive, relapsing disease. So you do want to be careful that when you're looking for a one-shot solution, those solutions tend to bring some side effects, and also it may not be sustainable. So once you're off those medications, it could be relapsing again, and usually the bounce back weight is harder to lose. Some words I want to put into meal planning. So as we also mentioned in the presentations, that there's really no one meal plan that fits all. So really what you want to focus on is what is it sustainable for you, what fits your lifestyle, what fits your family, right? So, and the other thing about weight management is also accountability. Do it with your community, do it with a village. So a lot of people find their coworkers, do the bet, the game, or with family. So everyone goes out and take a walk after, dinner and things. So I would say sustainability is really also a big key when you're looking at meal planning ideas.
Okay, our next question is, does weight training help in weight loss?
Absolutely. So we didn't really go in depth in terms of physical activity that's recommended in weight management, but like I say, always start small and then keep moving forward. Our big goal is actually building up 30 to 45 minutes of aerobic plus 30 to 45 of anaerobic, which is the weight training, 3 to 4 times per week. So that is really a big goal. But weight training is really directly linked with the muscle building. So we talked about the lean tissues really account up to 80 to 90% of your metabolic rate. So the more muscle mass that you have in your body, the higher metabolic rate you have, and of course, the longer you can sustain the ideal weight that you want.
Okay, thank you, Dr. Huang, for this insightful presentation. This does conclude our program. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.